Hello, I'm Dr. Colm Henry, Chief Clinical Officer for the HSE. If you're between 18 and 34 years old, I want to talk to you about your COVID-19 vaccination options. The advice from the National Immunisation Advisory Committee, that is NIAC, remains that mRNA vaccines, that is Pfizer and Moderna, are the recommended vaccine for people aged less than 50 years. I'm pleased to tell you that we are now able to offer people aged 18 to 34 years an opportunity to get a viral vector vaccine, that is Janssen or AstraZeneca, if they choose to do so. This will allow people the option of getting a COVID vaccine weeks sooner than we expected this to happen, and this is especially useful because of the increased risk with a new Delta variant. Since the 5th of July, many pharmacists are giving the single-shot Janssen vaccine to people aged 18 to 34 years who register with them. The full list of pharmacists who are giving the vaccine is on hse.ie. Shortly, you will be able to register on hse.ie to receive a viral vector vaccine. Janssen and AstraZeneca vaccines are known as viral vector vaccines. We are able to offer this option now because NIAC recently updated their advice to say that it is okay to offer viral vector vaccines to people aged less than 50 years. The age-based vaccine rollout is continuing apace, and we have opened the portal to people aged 30 to 34 years of age, and we will start to call them for a vaccine as soon as we can. We will then continue to move down the age groups over the coming weeks as quickly as possible, right through to August. We expect it will take several weeks yet before we can reach everybody in the 18 to 34-year-old age group. This is because there's a limit to how much mRNA vaccine we can get each week. It's for you to choose whether you want to opt for the viral vector vaccine or to wait for the mRNA vaccine later. We prepared a leaflet that sets out the pros and cons of getting the viral vector vaccine now or waiting for the mRNA vaccine later, and I will give you some of the key points in this message. The key points about the mRNA vaccines are that they've been tried and tested over the last year or so, and they're licensed as safe for use in people aged 18 years and older. The mRNA vaccines can be given to people who are pregnant, and one of them is also licensed for use in people younger than 18 years. NIAC say that mRNA vaccine is the recommended vaccine for people aged less than 50 years. The research carried out shows that the protection from infection after mRNA vaccines is somewhat better than the protection after viral vector vaccines. Like all COVID vaccines, the mRNA vaccines cause some common side effects such as fever, aches and soreness at the injection site, but the rare clotting disorder with low platelet count known as TTS is almost never seen after the mRNA vaccine. It is important that you complete your full vaccination course of the mRNA vaccine, receiving 2 doses to get full protection. And you get full protection 1 to 2 weeks after that second dose. If you prefer to wait for the mRNA vaccine, it's a perfectly reasonable choice. We'll get to your age group and to you as quickly as we possibly can. You can reduce your risk of catching COVID-19 while you're waiting to get the full benefit of the mRNA vaccine by being very careful to follow all public health guidance. If you change your mind at any time, you can register with a pharmacy that is giving the vaccine, and they will get to you as soon as they can. The key points about the viral vector vaccines are that they have been tried and tested over the last year or so, and they are licensed as safe for use in people aged 18 years and older. NIAC now says that the viral vector vaccines can be offered to people aged less than 50 years if they want to get vaccinated earlier than we can get to them with the mRNA vaccine. The research carried out shows that the protection from serious disease with viral vector vaccines is very good. Like all COVID vaccines, the viral vector vaccines cause some common side effects such as fever, aches and soreness at the injection site. Viral vector vaccines also cause a clotting disorder with low platelet count known as TTS. This is a very rare but can be very serious. There are more details in the leaflet on hse.ie. It takes 2 weeks after the single dose Janssen before you have full benefit of vaccine protection, and it takes 15 days from the time of the second dose of the AstraZeneca vaccine to have the full benefit. That does depend on you coming to your second AstraZeneca dose when it is due about 4 weeks after the first dose. If you prefer to go ahead with the viral vector vaccine now to get protected against severe COVID-19 disease as soon as possible, you can register with a pharmacy that is giving the vaccine now, or you can register on hse.ie shortly. You can reduce your risk of catching COVID-19 while you're waiting to get the full benefit from viral vector vaccines by being very careful to follow all public health advice. If you change your mind, let your pharmacist know now, so you can let the HSE know. This short message gives you the main points to think about. I don't want to push you in one direction or another. It's your choice. I encourage you to look at the leaflet or the information on hse.ie for more information. Please do remember that whatever vaccine you get no protection from a vaccine the day you get your first jab. It takes at least 2 weeks for your immune system to work on the vaccine before you have protection. And for all the vaccines except Janssen, which is single dose, it takes 1 to 2 weeks after your second dose before you have the maximum protection. If you are getting any one of the 2-dose vaccines, it's really important to come back for the second dose. Mrna Vaccine, and thank you for listening.